So I'm going to be talking about the ACRM exams and assessments, but I'll be focusing just on the written exams for today. So I'll be going through the multi-choice and a little bit about CBD. I'll quickly chat about that. But the other assessments that we have is also the multi-source feedback, your mini CEXs, and the STAMPS exams as well. So the recommendations that I would give to ACRM registrars would be to do your multi-source feedback and your case-based discussions early on. As someone who left it to my last assessment piece for my case-based discussions, as do most registrars, I can only stress, please try and get that started early because you're going to be facing lots of delays potentially because it does depend on you submitting the cases that you want the examiners to choose. That takes time for them to review the cases, approve your cases, and say if they can't read the text properly, or the case is inappropriate, or it doesn't have enough content, or you've left some identifying information in there, that will delay them being able to and then once you come to the case-based discussion to actually have it booked in, again, that takes time, and then it takes time for them to examine you on that. So yeah, try and get that done early, and I'd probably recommend getting it done around or before your STAMPS exam because it does take quite a long time. And multi-source feedback, that's pretty easy. So yeah, just get that started when you can. So yeah, with your case-based discussions, try and keep detailed contemporaneous notes while you're seeing the patient. So it's just going to be easier when you go back to choose your cases for that assessment piece. And I'd also recommend doing your multi-choice and your STAMPS exam within the same half of the year, or the 6 months that they offer the exams, just because you're going to be studying and the content is going to be very relevant. So yeah, I wouldn't drag it out until the next year. Try and do it in the same time if you can. And your mini CEXs you can get done during your ECT visits. So that should be quite easy to get them all signed off. So with regards to the ACRM multi-choice, so there's 125 questions and you have 3 hours. So it does cover the 18 curriculum statements. You can find all of this on the ACRM website. So I won't go through all of the curriculum statements, but they do include Aboriginal and Torres Strait Islander health, child and adolescent health, women's and obstetrics health, and surgery as well. So do look at the ACRM website. It does give you a lot of information about the multi-choice exam in itself. So it is an online exam, so you will either be sitting it at a college arranged location, or if you've self-nominated one. And basically the platform looks very similar to what Shirley showed with regards to the RACGP exams, where on the top left hand side you'll see all of the number of the questions, so 1 to 125, and you can skip questions if you want to, so you can go further down the track. You can actually flag questions, and I think it turns them orange on the left hand side where you've got all the numbers of the different questions, so then you know that's the one that you're going to go back to. And yeah, so you can go forwards and backwards in it, and obviously keep abreast of the time. So research has shown that your first attempt is going to be your best attempt at passing, so try and make it your actual best attempt. The pass mark also varies each year depending on the difficulty of cases, so I can't tell you it's going to be 75% or 60%. It really depends on that cohort and the difficulty of the questions. So the resources that I would encourage you to use for the MCQ, which would also be relevant to your STAMPS exams as well, would be the ACRM curriculum. That tells you basically what they're assessing you on. So make sure you've read the ACRM curriculum page to page, from front to back. Yes, it is a very long document, but that's what you're going to be examined on, so make sure you read it. I would highly encourage you all to do the Romeo modules, and if you don't have time to do all of them, which there are a couple of hundred, there are a few, when I say a few, there's probably about 80 of them, flagged ones that are actually FACRM recommended, So yeah, if you've got your Romeo Access, make sure you definitely do them. And the one that particularly comes up in exams, either in the MCQ or on the stamps exam, is Parkinson's, and there is a really great Romeo module on Parkinson's, so make sure you do that one. That's a hot tip. Knowing your guidelines as well, so all the national guidelines, so the asthma, diabetes, heart failure, all the regular ones that you are using during your day-to-day work are very relevant, and make sure you do know them front to back. So yeah, as Shirley said, know the common stuff really well. That will really help. Your therapeutic guidelines, up to date, DermNet, they actually use exact photos from DermNet in the exam, so if you've got good photo recognition or photographic memory, that'd be really helpful. And the RACGP Red Book is really great for your guidelines for screening, so I found that really helpful. And you will have some emergency cases on there as well, so Life in the Fast Lane was a great resource for me. Things to do for preparation for your exam. So look at the public reports that ACRM puts out. So if you've not looked at these before, basically it gives you a rundown of the kinds of questions that have been asked in the past. So basically the major headlines, or gives you a bit of an idea, like was it a Aboriginal child with a sore knee, or was it a foreign body in an ear? So it gives you a bit of an idea what kind of question they're going to be asking you. And it also gives you an idea about the number of people, or the percentage of people who correctly answered that question. There's public reports up on the ACRM website from 2016 onwards. So each year there's 2 exams, so there'll be plenty of reports up there. It gives you lots of information, and also gives you a good outline of what they thought was the reasons that some of the registrars struggled and what the examiners are looking for. I also use the GPRA exam prep book. The clinical cases one was really helpful. There is a section in there with multiple choices, and I thought that was really helpful for ACRM registrars as well. So if you can get your hands on one of those, they're very, very good. Other things that you can do is obviously form a study group, and if you can't find a study group within your own networks, there is the ACRM Registrar's Facebook page. So you can just do a shout out looking for people to do study group with. And there's also the GPTQ exam preparation Facebook group as well. So yeah, just make sure that you are on that, because they do have medical educators who post questions on the GPTQ exam preparation page, and then they'll go through the answers, and really highly recommend it. If you haven't been doing it, please get on there. That will really help. You get into the mind of answering questions in an exam scenario. So practice MCQs, ACRM does actually send out people who are sitting the exams about a month before your exam date, a familiarization activity. So basically you've got a link that you log into, and it looks pretty much the same as what you're going to see on the exam day. And I think it's maybe 20 questions or 25, not a huge amount. But yeah, it goes through the questions, and you do get the answers at the end, so you have a bit of an idea as to how well you've scored, and the reasoning as to the answers as well. Colleagues are also a great resource that you can use if they've got past exam questions or other MCQs that you can use. That'd be a really good resource to have. The RACGP check is also a great resource. Obviously you need to have RACGP access, so if you've got a great friend who has access and they can give you that. They do have, I think, 10 MCQs at the end of each article or each assessment. And there's the BMJ on examination. So yeah, GPTQ does give you access to that for 6 months for people who are sitting their exams. So if you haven't already signed up for that one, you can get in touch with GPTQ and get that sorted for yourself. So the areas of focus for the ACRM MCQ, this is actually from an ACRM document. I've just typed it out because it's quite extensive, but I wanted to show you what is mainly on the ACRM MCQ exams. So there is a huge focus on adult internal medicine. The next focus would be child and adolescent health and Aboriginal Torres Strait Islander health. So know those topics really well. They are quite heavily weighted throughout the whole exam. And then your other top ones would be musculoskeletal, obstetrics and women's health, aged care, dermatology. There will be ethical issues in there as well. So do be mindful of that. It's not just purely what you're